Soroti, almost Ugandan dance. The Ugandan dance, oh, the Ugandan dance. The Ugandan dance, oh, the Ugandan dance. Dance. The Ugandan dance, oh, the Ugandan dance.
So a good evening, my viewers. We are back on our program, on our show, The Ugandan Nurse. This evening, I'm catching up with Miss Yedidah Ssentongo Balava. She's a nurse. She's a psychiatric nurse that has walked through various hospitals. She has, including Butabika, Mulago. She has also trained as a tutor. And we are going to have a discussion on that, on her professional journey in the nursing fraternity. Before I begin this show, I want to remind you that COVID-19 is still serious, and even after I've fully immunized, I still wash my hands, I still wear my mask. But for this edition, I and my guest, because of our distance, we are going to remove our masks so that we are in position to have this show very well.
Okay. So,
sister, feel free, please, to remove the mask, and we share.
All right.
So, in this discussion, we are going to be talking about a number of things. My guest today, as I earlier introduced, is Miss Yedidah Ssentongo Balava Biribonwa. She hails from Hoima district. She's a psychiatric nurse. Sister, you're most welcome.
Thank you so much.
This is the Ugandan Nurse Show, and we are trying to trace the history of nursing in Uganda. Today, I'm so delighted that I'm seated down with a psychiatric nurse. She's going to give us a picture of the psychiatric nursing clinical practice and training in general. So, our guest would want to know, who is Sister Yedidah Ssentongo?
This Sister Yedidah Ssentongo Balava, my maiden name is Biribonwa. For those who know me, those who don't know me, yes, that's me. As he has said correctly, I'm born from Hoima, and I studied at Muhwiju Primary School. I went to Duhaga Secondary School, and thereafter in 1979 I joined the Butabika School of Psychiatric Nursing at certificate level. At that time we had Mr. Serubombwe Simon Peter as the principal of the school, and other tutors like Miss Rosemary Nabatanzi, Mr. Baitemukito. Baitemukito, I think, has died since long. We also had Mrs. Mubala. They were our tutors. It was so pleasing, so delighting to be in a nursing school.
Probably someone would want to know what was exciting about nursing those days. What excited people to join nursing?
You know,
those days.
At first, we would see nursing care when you fell sick and you went to hospital, and then they would pinch your bums. They would give you PPF or chloroquine, those things. But then now, finding yourself that in a very short time of like 3-4 months after your PTS exam, you will be giving people injections. It was so exciting.
Really?
And my background, my father actually was a general nurse.
Oh, so for you were from a house of nursing.
My big brother, who was 5 years older than me, was a nurse. So I was in that sort of field. And my uncle, who actually loved me so much, was a laboratory technician.
So you're from a family of clinical
and my young sister is a psychiatric clinical officer, but she started as a nurse, as a psychiatric nurse. And with that background, so nursing was the thing at our home, and I really thought I was in the right place. My father had wanted me very much to do midwifery. But the time we came for interviews, it was during the war that I think took away Amin. So, and midwifery certificate was being offered at very distant places, like Arua, Lira, Gulu, by then was still there. And I feared. But when I saw psychiatric nursing at Butabika, and Butabika is perhaps nearer to Hoima, I switched. I said, no, I think I should go to Butabika. That's how I switched.
Weren't you scared of those patients? Because we've had myths in the community. People think psychiatric nursing is a course for men. Now, how do you do it as ladies in the field?
I actually didn't fear them. Surprisingly, when I passed the interview and I was admitted to Butabika, when I came and disembarked from the coaster which brought me from the park, from Kampala Tax Park, it's a mental patient who identified me and said, this one must be my nurse.
Really?
Nurse, you bring your suitcase and I carry for you.
And he did.
And the patient carried my suitcase up to the school, and I was following behind him. And he took me up to the warden and said, Mama, I have brought another Msao here. You receive her. And the patient went out.
So you go, your certificate in nursing at Butabika. What was your next step of education?
After finishing certificates, I worked for some years, 5 years, 3 years at Butabika and 2 years at Mulago. Then I applied to go back for further
Mulago,
studies.
that was Ward 16, mental health.
Ward 16, mental health, yes. Though, towards the end of my second year, I was asked to help at the pediatric general ward.
Now I'm seeing a psychiatric nurse in a pediatric ward.
Yes.
How were things similar?
No, they were not similar at all. Had been working with adults, mentally sick. Babies. Now I'm working with children, but mentorship that time was very serious and very good. The nurse in charge received me very well and took me through like for a week and attached me to another nurse and they taught me what to do at that ward. And I found my life comfortable there. Yes.
So you go from Mulago
and I went back to Butabika to do my diploma in nursing.
Yeah.
Psychiatric nursing. That was 1987.
1987.
Yes.
So you finish your diploma in psychiatric nursing.
In 1988.
During those years, we understand that double training was the trend. Did you double train?
Yes. After that, actually, after I finished as a diploma psychiatric nurse now, I was asked to go and become a clinical instructor at the school. At
Butabika.
Butabika. So I went and assisted. Then it's from there I requested Mr. Servombo to allow me go to Lubega School of Nursing and do general nursing. Yes.
And how did you find general nursing? Was it so different from the psychiatric kind of training?
Yes, different. But whatever you do for a general patient, most of the things, you will do them also for a psychiatric patient.
Did it excite you and pull you to the general nursing to drop your psychiatry?
It actually excited me, but I thought I should pursue psychiatric nursing and remain there and work there. Though it added a lot
to your knowledge and
to
way
my
of
knowledge
practice.
And practice, and then teaching. Yes.
So from there we learned that you actually became a tutor. Did you just come from the blue and became a tutor?
No, after that, as I was a clinical instructor, Miss Nakayenga came around. She was on support supervision.
Miss Nakayenga was working with ministry?
Yes, she was our supervisor at the Ministry of Health. Okay. By then in Tebe, training division. She was a very big lady there. She came and pleased that I should go to Tutors College.
Tutors College. So you go for a diploma.
Diploma of Makerere University in health tutorship. I did health tutorship 2 years. 1994, I came out and went back to Butabika and worked. Yes, worked diligently. And then 1996, I did mature age entry exam because the bachelor's degree had started. I had wanted to start earlier on, but that time they were still taking only those with midwifery.
You joined a bachelor's in 1997.
97.
Those are around 4 years after the program had started.
Yeah, I think so. Because the first years, they were taking people who had midwifery. Yes, it was so inclined, the course was more inclined to midwifery.
Because probably the reason was to reduce maternal mortality in the country.
Yes, that's why even the degree had been started, to reduce maternal mortality. Yeah.
Now this takes me to thinking. Someone begins a journey as a psychiatric nurse, but in a country where we know that we have only one school training psychiatric nurses, we only have a certificate and diploma. What did you think? You've done general nursing, you've also gone to Makerere, you're doing general nursing and midwifery in that bachelor's course. Didn't you think there was need for a specialization in psychiatry?
True. I thought about that, and I tried even to do applications abroad so that I would do my master's in psychiatric nursing. But I didn't make it because I would be told I have to pay so much tuition and there was no one to sponsor me. I gave it up.
So where do you think the challenge is? We've learned that you actually trained as a health tutor, you finish your bachelor's, you move, you begin, you become a tutor, you begin moving across the country as a tutor, as an educationist in the nursing arena. What fails, or why are we not having a specialized course or a bachelor's degree or a master's degree in psychiatry up to date? Where is the challenge?
Policy mainly, and then
anyway, do you think
yes,
we need them?
Mainly yes, we definitely need them.
Probably the people who concerned may think we don't need psychiatric nurses.
No,
that's far much specialized level.
We actually need them because when you are specialized in psychiatric nursing, actually you will assess the patient better. Exactly. You will be able, that patient will get care, specialized care immediately, as immediate as he needs it. But now without that, a nurse, takes assesses the patient and sort of says, this patient is suffering from this, waiting to see the doctor. You understand? Which delays commencement of treatment. And it prolongs patient's time that he or she spends in the hospital, which I think is not good. When psychiatric nurses or even other areas of nursing are allowed to specialize, they will be, assessment of patients will be eased and prescription.
What can we do to convince public service to understand that? Because the country seems like public service and the ministry seems that they enjoy the services provided by the certificate and the general practitioners.
It's not about enjoyment really. Perhaps also the economy of the country.
But our colleagues, the doctors are advancing and are actually being sponsored. Probably someone who may, the other question I was going to ask you, were there opportunities for you to get scholarships, to go back and study as nurses during those days?
Yes, most of those other courses that I did, actually government, I was sponsored by government.
Those chances are very rare nowadays.
Yes, they are no longer there. Of course, with the population expansion and all those things, I think things have changed along those lines.
To my viewer, don't forget, I'm seated down with Miss Yedidah Ssentongo Balaba. She's a psychiatric consultant nurse that has worked diligently for the mental health of Uganda through training and even on the clinic, on the wards. She was in the wards in Butabika, she was in the wards in Mulago. She also went to the classroom to teach psychiatric nurses. She also did administration of the health training institutions. I'm talking Soroti School of Nursing to Butabika School of Nursing. I'm talking Kabale School of Nursing. All those schools, she has been there as a principal, and she probably has a lot to tell us about the education sector in the nursing profession. What are some of the achievements we've achieved as a profession when it comes to the education sector?
Yes, one of my first achievement is that personally I have been able to grow in the profession. Because at the time I retired, I had trained up to master's level in counseling psychology. From
certificate to diploma, very many diplomas.
Yes,
we are talking diploma in mental health,
and many
diploma
certificates of
in
attendance,
general nursing, diploma in tutorship, to a bachelor's, and she never gave up. She has a master's degree in clinical psychology. I would want to congratulate. Not very many nurses have done that. Congratulations, Mrs.
Thank you. Thank you. And how I wish all nurses should be zealous, should be focused, and not be derailed. Actually, even after bachelor's, I was able to do other 2-3 diploma courses.
Wow.
One in maternal child health.
Wow.
Outside the country, it was in Japan. 2, I did a diploma in human resource management, because when I became a principal,
you realized you had to manage human resource.
Managing people. So I did a diploma in human resource management from Israel, and also went back and did management of higher institutions. Okay.
So you were really a very technical person when you held those offices of as a principal.
By God's grace.
Surely. Probably now we want to get the nursing education from the lens of a principal, someone who has been in the education sector.
Yes,
I'm sure you've seen the examinations board, the examinations nurses do. You've seen the training nurses go through. You've seen them in the classroom. You've seen them on the ward. Where are we doing so well, and where are challenges? Where do we need to improve?
So far, so good. As you have said it, in most of those areas, we are doing well. But where we need to improve, we need, I think, to control numbers.
Numbers
that are admitted on a single entry.
But now these are private schools. Government opened up the sector for private schools to invest.
It is a policy. Government decided to liberalize and privatize education, but government is still responsible of ensuring that quality is controlled, quality is well managed.
So the challenge is with quality control, regulation and supervision of those training institutions.
Exactly.
So what can be done?
Just improve on the policies. We don't have to stop private training schools. We don't have to stop liberalization, but improve on the policies on monitoring.
Because someone will argue that the policies are
quality there. And yes, I think
someone will argue that the policies are there. So who is not doing their work? Can we say it's ministry? Can we say it's the principals in the schools? Can we say it's UNIMEB? Can we say it's the council?
I don't think so. Everyone is doing their work. But it's just like when you, I'm going now to talk like someone who is at home, because right now I'm at home. When I put on a saucepan on fire, I can check on the fire, even if it is on gas or hot plate. And if it needs increasing, I increase the fire, depending on what food I'm cooking. So government also needs to do that. So
what we are learning from this discussion is that there is someone who is not going to check on the food that was prepared.
Being prepared.
That the food that is being prepared. So what Miss Yedidah is saying is that there is someone, there is a group of people that are supposed to go and check the fire. If you're one of them, please do, because it is affecting the nurses training in the country. We are having very many private schools, and they are, the uptake of the students is not controlled by anyone, and there is no certainty of whether they are trained or they are not trained. So still from the lens,
I wouldn't say that there is no certainty. Certainly they train,
but the quality,
because there is UNIMEB,
which
examines, and all these students from all these schools, whether government or private, do the same exam.
True.
The exams are not different.
True.
Unlike at universities, each university sets its exams.
Yes.
But with these certificates and diploma courses, the exam is one for all the schools in the country. And the students definitely pass, because even when it's marking time, you can't know which student you are marking. They have done all that, and the students pass. But also, after they exit school, the lack of real jobs, the patient care jobs,
people lose the skills.
Yes, affect these girls and boys' skills that they have acquired. And you remember, skills acquisition is a continuous process.
True.
Even after training, there are certain things which you meet in the clinic, clinically, and you learn them on the job.
True, that's
you learn them clinically.
Actually,
but these girls and boys
every day you learn something.
Are finishing their courses. They do wonders with the distinctions, with good grades, and then they end up in pharmacies.
But someone else is going to also argue that grades on paper don't directly mean that someone has the skills.
But give these people jobs and let them try out their skills. Let them be mentored again by seniors, because at the places of work, there are those diploma nurses.
True.
There are those degree nurses. There are intern doctors and other people that they work with. That's how we have developed, by the way.
Actually, this brings me to a question on clinical preceptorship on the wards. We know that every training school identifies mentors that are going to train students on the wards.
They do.
Do you think that thing is being done? Do you think the skills are transferred in a good way to the students?
Yes, they really UNIMEB and the Ministry of Education and Nursing Council have done their best to the extent of developing tools that are comprehensive
for the mentors,
for the students. Yes, and the mentors have been taken through. They have been oriented on how to mentor these students using those tools
on the wards.
And the students book before. Sister, Tomorrow, I'll be coming for such and such a procedure. I'll be coming for such and such a patient, for such and such. Sister, I would like you to be there for me. And I think it is doing well.
Let me drive you back to psychiatric nursing.
Yes, please.
In one of my researches, I found out that there was a lady who is asserted to be the first nurse, psychiatric nurse in Uganda. That is Miss Selina Rashana. Did you get an opportunity to ever work or under her, or being trained by her?
Oh my. That lady was a great lady.
What was unique about her?
She was so educative. She loved students. And at her level as a principal nursing officer.
So you met her when she's a principal nursing officer?
Yes, she was the head of nursing services at Butabika.
That is in 1979 when you're joining.
Yes, please.
As a young girl in
Yes, and she was in her middle age, very vigilant. Oh my. You know, she would mentor. She would come to all the wards. She knew all of us. Of course, that time, students, you would be like 30 in that class, in your set.
True.
And 30 would be the biggest. Others would be 20, 10, 15, like that. So she knew all of us. She loved good discipline amongst nurses and trainees. She was a timekeeper. She really mentored us thoroughly into this profession. And when you talked about her, my heart leapt. You know, she died recently of COVID.
I was informed, actually. I had just got in touch with one of the relatives to schedule an appointment with her. And I was given the bad news of her demise.
She died. But
may her soul rest in eternal peace.
Amen.
Now, we wanted to look at the journey of psychiatric nursing.
Yes, please.
We know that Butabika came as a psychiatric nurse after those patients were taken to prisons in Hoima. They were kept in Hoima for a long time.
Yes.
And there wasn't so much of their care. In the community still perceives mental health illnesses as evil spirits, things related. A lot of myths around psychiatric nursing. What has been the journey? What have been the achievements of psychiatric nursing in Uganda?
Well, the achievement has been that, as you said, Mrs. Rashana was among the first psychiatric nurses. She was trained in Britain and came back and started training other nurses through mentoring them and was working with the school. By that time, the schools were actually under the hospitals. But psychiatric nursing grew from certificate level to diploma.
True.
Then from diploma, I think it has stagnated there. There hasn't come a degree in psychiatric nursing, but it's my prayer that it will come to pass. For sure it should.
I think you should be putting a very big block to that dream.
Big firewood.
Or firewood whatsoever. You should do something about it.
Yes, I think there is need to have psychiatric nurse at degree level. I think they would do the best.
Actually, even at masters, because they feel
And
we
at
have.
masters,
probably that's the reason why we
and
don't have very
PhDs.
many training schools, because people have not specialized in the area. Those who have specialized from abroad.
Exactly.
Now this brings me to some other discussion. So concerning retirement, how can you advise nurses? We understand nurses are not earning a lot of money, but how can you advise them to prepare for retirement? So that we've had issues where nurses retire and they're in staff quarters. People refuse to get out of staff quarters. People get mental illnesses because of retirement.
No.
How? What advice can you give a young nurse, one who has begun working, one who has taken some years working?
Money for nurses is not to reach that enough extent soon, but the culture of saving has done me great. Saving and then taking risks to do little things aside that bring money has helped a great deal.
You talked about saving. Some people may think they earn too little, that they can't even save anything from it.
But right now, what the nurse is earning is actually like so many times what I earned.
Someone will argue that there has been money inflation.
They can argue that, but also saving is a sort of culture that needs to be inculcated into people.
That's true.
It could be part of the things that should be put in these nurses as they are walking out of school or from school. Saving culture. Actually, for me, what I have done, I do it with my own children. Even when they are very young, we open up her account or his account.
Depositing somewhere.
And they ask, this 200 shillings, can I have it? And they put in their boxes. Then when it is full, they go to their banks and it is offloaded and they keep on like that. It's a saving culture really that we have to develop within ourselves and ensure that whatever little you must balance the boat.
True.
You must educate children, you must survive, they must feed very well, they must have good health, and they must study, and you must save. And because I did that, actually, I don't have depression.
True.
I have something little that can take me through.
True.
Yes.
That's how people view us. People view us as people who are workaholics.
Because that's how we are viewed.
So what can we do? Shifts are set, but people don't follow the shifts. The staffing is low.
And as you continue to grow in the profession, the more you become busy. You become busier as you advance. Some of the things are inevitable. Like there was no way I would stop going to meetings, to workshops. There was no way I would stop going for examinations, And like children, they would be like, Mommy has just come from a workshop and now he's going for exams, those things.
I think that's something good for the nurses out there. We, the young nurses that are working, we understand we are not getting a lot, but it's a culture. She has told you that you have to learn and keep practicing if you want to keep and prepare for your retirement and have a nice one like she's enjoying hers. Maybe I want to ask Miss Yedidah whether she has anything she feels she should say out to the nurses out there as we complete this session.
Yes. Nursing, once you become a nurse, I would like to advise colleagues out there, please don't quit.
Don't quit.
Don't quit. Be there and develop within there. You will enjoy it. You will love it. And you will remember to say, even when I will have departed, that, I think she was correct. I shouldn't. And I did it. I didn't quit. These other things are quite ahead. And also endeavor to develop your career. A certificate is not enough. A diploma is not enough. Even 1 degree is not enough. And right now, things are improving. What we used to go through the laborious sort of, process it no longer holds. For us, you had to double train to be able to do either nursing administration or tutorship. Now it's no longer a requirement.
The trends have changed.
So please, go work after you have trained. Go work.
Go back to school.
Go back to school. From school, work, because for every training, you need a relevant experience.
True.
And then you'll enjoy nursing.
Thank you so much, Miss Yedidah, for catching up time to discuss with us and share with us your journey in the nursing profession. For our viewers, we are still on the journey of tracing and documenting the history of nursing in Uganda. Today, I sat down with Miss Yedidah Ssentongo Balava. She is a psychiatric nurse consultant. She has been a nursing educationist, and she still is. She has been a principal of schools like Soroti School of Nursing, Kabale School of Nursing, Butabika School of Nursing, and has worked in Butabika as a mental health nurse. She is retired, and she has told you that serving is part of what you're supposed to do as a nurse. And most importantly, don't quit. Thank you. Let's catch up the next time when we get another historical on the Ugandan nurse. Thank you. Special regards to my camera person, Timothy, who is here to make sure that our images, our videos, our audios are very clear to you. I continue to appreciate Miss Beatrice Amuge, the Commissioner Nursing. I appreciate Elizabeth Pearson, the Chairperson of the National Healthcare Conferences. I appreciate Miss Irene Atuhaire, the Deputy Country Director of SEED Global, and everyone that has supported this journey of tracing the history of nursing in Uganda. We catch up next time. Thank you.
Ugandan